Some new information about overdose deaths in Nashville. The vast majority of people with traces of fentanyl in their system. Leaders say it shows the need for changes at the southern border. Nicole Smith joins us with the latest data.
Hey, good morning, Neil. One of those leaders is Tennessee Congressman Mark Green, who was part of a hearing in Texas to call attention to the situation at the southern border. Now, according to Metro Public Health, there have been 103 suspected overdose deaths in Nashville as of March 4th. That's compared to 136 during
the latest data on drug overdose deaths in New York City shows they're at unprecedented high levels, increasing in 2021 by 78% from 2019. The city health department says about 80% were due to fentanyl, a synthetic opioid about 50 to 100 times more potent than heroin. Fentanyl-laced heroin was found to be the cause of the accidental overdose death of beloved film and TV actor Michael K. Williams. It's a national crisis that should be a priority.
This is the greatest threat we've ever faced in drug law enforcement. Nearly 108,000 overdose deaths in a 12-month period. 295 people dying every day, Lisa, is the equivalent of a 737 crashing every single day in the United States.
Another disturbing trend is the combining of drugs. The LA County Medical Examiner determined that Grammy-winning rapper Coolio, known for his hit song Gangsta's Paradise, died from an accidental overdose of fentanyl, heroin, and methamphetamine.
People have been cutting every drug with fentanyl for quite some time. It's everywhere.
Fentanyl is believed to be the most common cause in overdose deaths in California and in the country, according to the tracking system our partners at the San Francisco Chronicle created to better understand the scope of the overdose epidemic.
This information is crucial and is needed in every single jurisdiction across America because it is not only a San Francisco issue, but a U.S.-wide issue.
So people entering detox get tested to see exactly what drugs are actually in their system. The data also shows nationally and locally overdose deaths are highest among the American Indian population.
I was a bit surprised.
Nathan Blacksmith is the chief traditional health officer at the Sacramento Native American Health Center, or SNAC.
Basically, it informs us that we have a little more work to do in terms of how we are strategizing on connecting with our community, and also the collateral context. Who are the individuals that surround?
These four counties have an overdose rate of death rate, that is, of more than 70 per 100,000. Del Norte County topping the list right now with a rate of 125. That's followed by San Francisco, Lake, and Mendocino counties. The U.S. rate, by the way, is 32 people per 100,000. And these are the counties in our area that have a higher rate than the U.S. average. We also have a link to the Chronicles interactive database right now. That's on our app.
In today's state of addiction, drug overdoses have killed more than 1 million people in the United States since 1999. The majority of those deaths happened in recent years due to the powerful synthetic opioid fentanyl.
Honolulu police now say a second man has died after an apparent mass overdose incident at a Waikiki hotel over the weekend. 3 others remain hospitalized, and police confirm fentanyl was detected at the scene. Our Nikki Schenfeld spoke to a family member of one of those who died and has more.
The brother of one of the men who passed away says his brother flew to Honolulu with his wife to see a concert Saturday night. He says the couple from Kona rarely go
Shocking
out.
scenes as 4 people are treated for overdosing from fentanyl in the same street at the same time. Ambulance workers try frantically to perform CPR. Fentanyl is an incredibly strong drug that's been linked to a spike in deaths across the US.